The first solution is to connect the filter directly on the suction tube that comes from the dental unit, and of course will go to the machinery room and the suction motor. So to do that, we just need to apply the filter on the tube like this, and then we can close with something stronger, and this part with the direction will go to the motor in the machinery room. This solution is fine when you can apply the filter inside the dental chair, so at the chair base if you have space, or in the machinery room when you have a wet suction motor or a liquid suction motor. The second solution is to apply a bypass. So this system permits to use the filter only when you need to use it. So you have here two different levers that you can open and close. So when I need the filter, I leave this one open and I close the other one. And this system is connected, of course, to the suction tube that comes from the dental chair, and in the other side goes to the machinery room as well. When I finish to use the filter, I close the lever here and I open the other one. And so I use the standard suction way as normally I use in a practice. This solution is good when I have a wet or liquid suction system as well, and permit to extend the durability of the filter. The third solution is to apply the filter directly on the suction cannula. This way is the faster because you don't need any installation, but you just apply the filter on the system that you already have. So to apply it, you take out the cover here, you put your cannula inside the filter, and then you can use the filter to the patient. So you can use and attach the cannula that we provide already in the assistant tray. When you have finished, you take out the cannula and you put back your cannula inside the instrument tray. So this situation is easier because you can apply in all the dental chairs that you have, and you don't need any installation, and you are sure to get all the amalgama that you need to put inside the filter without any waste of filter life. When you finish, you close the tap and the game is done. A way to avoid the installation of the valve for the basin inside the dental chair is to use the funnel. The funnel can be applied directly in your cannula, and so the patient will use this as the basin for the temporary situation in case of amalgama extraction.